purpose of this speech is to inform you about Arnold Chiari malformation. What is Chiari malformation? Chiari malformation is a rare neurological disorder whose signs and symptoms are not specific and often go undiagnosed, but can be treated with medication and surgery. Chiari malformation is when the cerebellum herniates down into the spinal cord and presses onto the brainstem. There's 1 in 1,000 people who have this condition, and most don't even know it. After a long time of signs and symptoms that were dismissed as other ailments, I myself was finally diagnosed in February of 2010. These signs and symptoms are not specific to this disorder, and sometimes patients are told by their doctors that they suffer from an emotional or mental problem. Chiari malformation often goes undiagnosed, but now we know a simple MRI can identify it. According to Vanita Singh, MD, Associate Professor of Neurology of the University of California, San Francisco, lack of awareness among patients and doctors is quite common. The symptoms of Chiari malformation are quite nonspecific and quite vague. It can go undiagnosed for many, many years. Before the invention of the MRI in 1992, less than 10% of cases were actually diagnosed. Since the MRI, more and more people are becoming aware of the reasons behind their symptoms. There is no exact answer to how many people have Chiari because a rigorous study to determine this has not been performed. They estimate a range from 200,000 to 3 million people have Chiari. There has not been an exact study on the morbidity or mortality. However, there are reported deaths due to the complication of the disease and surgery. In May of 2010, my medical team and I opted to have the surgery to halt the progression of my disorder. The surgery consisted of occipital decompression, which is a surgical incision made at the base of the skull, where then a small piece of the skull is then removed. And dura mater, which is the fibrous membrane that covers the brain and spinal cord, is also removed. The dura mater is then replaced with a piece of skin harvested from another area of the scalp. The tonsils of the cerebellum are then cauterized, thus allowing the cerebral spinal fluid to flow freely. The muscles and skin are then sutured back up. Follow-up includes yearly MRI scans and neuro exams. Since the surgery, I am approximately 90% symptom-free. However, most people with this disorder are not as lucky as I am. Chiari malformation manifests itself in such a wide range of symptoms that it is extremely difficult to diagnose. These victims go through life with many, many symptoms such as headaches, dizziness, muscle weakness, forgetfulness, trouble speaking, trouble swallowing, problems with balance and coordination, affecting the fine motor skills, drop attacks, nausea and vomiting, numbness of the extremities, chronic fatigue or blurry vision, to name a few. People who go undiagnosed can get very frustrated or simply accepting of these symptoms. Some people who are diagnosed wind up going through multiple surgeries over periods of many years. Because most people only have a couple symptoms, Chiari is often misdiagnosed as muscular dystrophy, fibromyalgia, or an emotional or mental disorder. Other conditions sometimes associated with Chiari malformation include scoliosis, hydrocephalus, and certain craniofacial disorders. When the disease presents in infancy, it can masquerade as gastroesophageal reflux, sleep apnea, failure to thrive, and less specific complaints. It is extremely rare that this disorder is diagnosed in infancy, except for extreme cases of type 2, which is associated with spina bifida, or type 3, which is more serious, causing severe neurological defects. usually resulting in death. In these cases, a portion of the lower back part of the cerebellum or the brainstem extends through an abnormal opening in the back of the skull. Finally, there is type 4, in which the back of the brain completely fails to develop normally, thus resulting in immediate death. According to the National Institutes of Health, Chiari cannot be cured. Decompression surgery is just a treatment method that has variable results. Research shows that surgery can improve symptoms for about 80% of the patients, but fails approximately 20% of the time. This is why surgery is considered a treatment and not a cure. During surgery, some doctors choose to perform the same surgery. The same surgery I had as explained earlier. However, some doctors choose not to open the dura mater, resulting in repeated surgeries. Without surgeries, patients who are participating in high-contact sports have a higher than average risk for sustaining a head injury or other severe injuries. People with mild symptoms or whose surgery did not bring any relief are often treated with medication. Doctors often prescribe anti-inflammatories, diuretics, and pain relievers just to manage the pain. These patients are also subject to regular monitoring, including neuro exams, yearly MRIs, the test of the motor skills, vision, and questionnaires. Awareness is the best treatment for Chiari malformation. As more patients and doctors are aware of this disorder, better diagnoses can be made and proper treatment can begin. So since so many cases go undiagnosed, if you have any of the symptoms mentioned earlier, request a simple MRI of the base of the skull. And remember, early detection is key. And when in doubt, persevere and continue to search for answers. Thank you.